Hi, I'm Dr. Joe Kort, and I'm with Modern Sex Therapy Institutes. And I'd like to introduce myself and tell you a little bit about myself. I have been a therapist since 1986. I have my master's in social work, and I then later decided to get my master's in psychology because I was going for my PhD in educational psychology. Following the master's, I was burned out. I didn't really enjoy the program that I was in, so I did not pursue the PhD back then. It wasn't until I was 45 years old that I went back to school and I received my PhD in sexology, clinical sexology, just like we offer them in Modern Sex Therapy Institutes. In the beginning of my career, I was mostly sexual abuse trained and specialized and sexual trauma. And for 25 years of my 36 years as a therapist, I was a sex addiction therapist. And I regret that because I now do not believe in that model. It's not a sexually informed model. I was not sexually informed. Even in sexual trauma training, they don't teach you sexual health. It's not an informed model. It's not a sex positive model. And so I became a member of ASECT. I started learning about sexuality on my own. I became certified. I became a certified supervisor and then a continuing education a provider. And the more I learned about sex, the more nuanced I understood, the more complicated things were, the more I just couldn't reconcile the fact that the idea that in sexual trauma work, the belief is if the trauma is healed, sexual health will surface. Well, that's not necessarily true. You have to guide your client towards sexual health that's most effective for them. If you're not sexually informed, you guide the client towards sexual health that you believe is sexual health, not what sexual health is for them. So I learned all of these things. It was very helpful to me. In 1993, after 7 years of being in the field, well, several years of being in the field, I decided to go off on my own and start private practice, which I've been in ever since. I now run a group practice in Royal Oak, Michigan. But I was also an out gay therapist. It was really important to me at the time to be a role model to other gay men, but to people in the LGBT community. And so I was out. And back then in the 90s, nobody was out. It was very rare to see an out gay therapist, particularly in the Midwest and especially in Detroit, Michigan, where I'm from. And I actually remember applying to be a part of this group practice. And they would, and I like to have the Advocate magazine in the waiting room so that my clientele that saw me, the LGBT community, would see that there's a place for them, that they're welcome. And the group said that they would allow for that, but I had to put my name in bold print that let everyone know that this magazine belonged to the practice of Joe Kort and Associates. And I was fine with that because I was not about to whisper the word gay back in the 90s, even though other therapists were so freaked out by being affiliated with anything gay. And at the same time, I want you to know that I mostly work with straight people. In Michigan, especially Detroit, Michigan, there's not enough gay LGBT people to have built up my practice. So I've always seen mixed sex couples. I've always seen heterosexually identified men and women. 75% of my practice was that, 25% was LGBT. In my 40s, I was when I became increasingly aware of sexual health, left the sex addiction community, and also stopped identifying myself as a sex addict, which I was doing because I couldn't reconcile my kink identity. I had kinky sexual fantasies. I was ashamed of them, but through my own process as a professional, through my own therapy, which most of my life I've been in, I realized that I'm just a kinky guy and it's okay. That's just as okay as being gay. And so after all these years, I'm proud to be an open professional with the specialties that I have. My specialties today include male sexual fluidity, where I see a lot of straight men who have sex with men or have sexual fantasies about men, and helping couples understand how to reconcile that in their relationship. I do work with mixed orientation relationships where one partner is not straight and one partner is. I work with male survivors of sexual abuse. I myself am a survivor of sexual abuse. And so I had to unpack that throughout my life in therapy. I work with out of control sexual behaviors. I'm an imago relationship therapist. I love working with couples, love learning about relationships. And you know, the biggest secret that a lot of therapists don't admit is that you learn a lot about yourself through doing therapy for others. So I have learned a lot about my own relationship by sitting with other people's relationships because I don't see myself as very different as the clients that sit across from me. I'm a humanistic therapist. I'm human focused. While I have my own interventions that I've been trained in and that have worked for me over the years, we're humans first, and that connection is really important. I feel that way in the school as well, that our connection is what's going to help get people through, get students through to their certifications and to their PhDs. So I'd like to welcome all of you into the program. I hope that I get to know you. You're getting to know me in this way. And I hope you have a lot of fun and we laugh a lot through the program, because to me, laughing about the deepest, darkest things can be therapy and healing in and of itself. So thanks, and I look forward to meeting all of you.